Hello and welcome to the Unstoppable Joy Podcast, your roadmap to a joy-filled life. I'm your host, Kathryn McAdam. I'm a nurse practitioner, single mom, worship leader, and a Christian minister who has also experienced the heartache of a marriage to a drug addict, divorce, and homelessness. Most of all, I'm an overcomer who can completely understand what you're going through and speak life into your situation. It is my desire to bring hope and encouragement that you too can live a life of unstoppable joy no matter what life hands you. I'm not here to give you pat answers and cliche scripture verses. I'm here to honestly share with you the mindset hurdles and the spiritual and emotional barriers I had to overcome on my journey to becoming a comeback queen. I believe as I share my story and those of my guests, you too will be able to find your unstoppable joy. So, pull up a chair, grab your favorite beverage, and let's get started. So, I want to welcome to the Unstoppable Joy podcast my nephew. Don't tell everyone else he's my favorite nephew. And Um, he is also a physician. He is a addiction specialist, and I have invited him here to our podcast to just talk about addiction. It's a big part of what I talk about on the Unstoppable Joy podcast, and a lot of my story has to do with being married to someone who's addicted. And my nephew Michael Cates is a specialist in addiction, and I've had the privilege of talking to him about this recently, and I just wanted to kind of pick his brain today about addiction and how to help people that loved ones that you have that might find themselves addicted. So welcome, Mike.
Hey, Catherine. Thanks for having me on. Excited to chat with you. Yeah, it's interesting. A lot of people they ask, have you had much experience with addiction personally? And your story is actually one of the stories that frequently comes to mind as one of the ways that I have witnessed how addiction really can impact families and some of the ways that it really transforms our lives. And so I'm excited to be here and chat with you about this. I'm kind of obsessed with it and would talk about it for lots of time. So excited to have the opportunity to chat with you about it today.
Yeah. So, addiction is a big, like you said, a big part of my story. And I just know how gut wrenching it was to be
hmm
married to someone that was fighting addiction and, that hope of them getting better. And why do you think that people end up going down that road of addiction? What draws people into this?
Yeah, it's so part of what I do as an addiction medicine doctor is looking at what we refer to as a disease model of addiction. That addiction is a disease and kind of moving away kind of a traditional view that somebody who has an addiction that there is that they're a bad person or that there's some sort of moral failing. Kind of the disease model of addiction says that this is a disease just like high blood pressure, diabetes, and so in exactly the same way that those things are influenced by multiple factors, addiction is really influenced by multiple factors. So, just in the same way that diabetes and high blood pressure can run in families, addiction can run in families. So there is a genetic component, but that is also difficult to pull apart the genetics from environment, right? That is it the genes themselves, or is it the environment that kind of accompany those genes? And so there's a lot of, so there's looking at there's nature, but there's also nurture, and those things do kind of combine together. Really, one of the biggest things that we look at with addiction is what is frequently childhood trauma, some sort of childhood trauma. I would recommend people take a look at the ACEs study out of California. Basically, we've learned that childhood trauma is incredibly predictive of addiction. There's some studies that suggest that trauma is more predictive of substance use disorder than diabetes is that the diabetes is predicted by obesity. So it's very complicated. Um, but one of the biggest things that I kind of delve into when I work with my patients is childhood trauma. And one of the things that, with through that ACEs study, one of the things that was identified is having family members who have a substance use disorder, and then frequently things like having family members be incarcerated, stuff like that has is highly correlated with substance use disorder, as well as some other mental health, as well as physical health issues. So, yeah, so so it's kind of like what goes into addiction. It's a lot.
Yeah, just like any disease process, it's a lot of factors playing into a lot of things. Like you said, like diabetes, it's not just, are you overweight? It's what is your genetic makeup and you know, are you sedentary and are, a lot of things go into that. But so how do you think that we, like my listeners, if they have someone in their life that is addicted, what is the best thing that they can do to help that person find the help that they need?
Yeah. So one thing that if you have somebody that you think might have a substance use disorder, the first thing that I would recommend doing is look up a local Al-Anon meeting. I'm not sure if you ever had any interaction with Al-Anon in your journey, but basically the idea of Al-Anon is it's kind of a sister group to Alcoholics Anonymous. It's a group that really exists out there for people who love someone with an addiction. And there's a lot of correlation between substance use disorder as well as codependence and things like that, which isn't a medical definition. Codependence is not a medical one, but I think where it should be, especially in the world of addiction. And so that's a really good organization because it really seeks to help people who love people with substance use disorder. One of the problems with substance use disorder is it has a so if you have diabetes, that is going to impact your family in that, maybe you guys don't have that Dairy Queen cake every year for your birthday, right? Maybe there are going to be some changes with diet and exercise but with substance use disorder, it has a tendency to kind of eat everybody around it except for that person. And so one of two things frequently happen with people with substance use disorder is the substance use disorder hurts the people all around that person. And then frequently what then happens is that person is just completely isolated from those who love them. But what can also happen is you can also have people get in like a very codependent relationship where that person is almost addicted to helping that person with a problem. And so Al-Anon is really good as an organization because it really helps people to figure out what are the things that I can do to help my loved one, but then what are the things that I can do to help myself so that I don't end up sacrificing myself on the altar of trying to help this person. And it really helps you to navigate, you know, i- where's the line between I am going to help this person and I'm going to stay with them to the ends of the earth, which is a really, really good idea in concept. Uh, but then the challenge is, let's say you have children, right? I'm going to love this person and stay with them to the point that it's hurting my children and putting them at risk for substance use disorder or trauma. And so it can be really, really challenging to navigate that. And there's not, it's a really difficult question and it really depends on the person. It can be really hard to know where is that line between do I continue helping this person or where is the point at which, I need to walk away, kind of in the same way that, Catherine, you're a lifeguard, right? You were taught that if you see somebody drowning, there's a way that you can save them where
Mhm,
you aren't also drowning. Because
mhm,
what you don't want to do is you have one person drowning on the beach. The only person than one person drowning at the beach is two people drowning at the beach.
mhm,
And that's going to be much more difficult. So it can be really difficult to kind of figure out, where that line is. And again, that's where groups like Al-Anon can be really helpful.
mhm. Yeah, that was one of the biggest, frustrations for me was, as a Christian, I didn't wanna get divorced. I wanted to, help my husband and get him healthy, but at the same time, I didn't wanna be enabling him, and in the end, I had to, like, have what, people talk about tough love and be like, you have to make these changes and stop endangering our family or we have to go. And so it is really hard, and it's like you said, it's very individual because you can't just give a blanket answer of this is how you're gonna deal with everybody, in every situation, but what resources are there out there for the person that's addicted, and, how do you find a good one? Um,
That's a great question. This is a major problem in that, um, y so if you have a heart attack and you go to any hospital in the United States, you walk in the room, they're gonna give you baby aspirin. They're gonna put an EKG on you. They're gonna check for cardiac enzymes. They're gonna call the cardiologist. You get the cath lab. The problem with substance use disorder is that does not exist. If you have a substance use disorder and you walk into every hospital in the United States, if you walk into a hospital in Boulder, Colorado, you're actually probably gonna get really, really good compassionate care. If you walk into one in, let's say, in the rural South, you're probably gonna get told to call up Alcoholics Anonymous or go to church, which those are both great things. But, if somebody came into the hospital having a heart attack, we wouldn't say, "Oh, you need to go to Overeaters Anonymous because your heart attack was caused by overeating." Right, and so it's a major challenge. So that's part of what my job as an addiction medicine doctor is, trying to build these systems so that when somebody asks for help, um, they can get it. And so the challenge is, I would say, if you have a doctor or a therapist or somebody that you trust, I would tell them that you're struggling and ask for resources. The real challenge is that in a lot of places there just aren't those resources. And so that's what I'm doing in rural Michigan, is I'm trying to be that resource in that community. So when somebody goes into any doctor's office, in that they can be referred to me and they can be given those resources. The challenge is is in some communities it just doesn't exist. But I would just say, start, you know, asking people, and I think that especially if you ask doctors, a doctor, a provider, your primary provider, if you have a therapist, ask them. If you live in the state of Michigan, I work for the Michigan Opioid Collaborative. If you look them up online, we have a database of all the providers who are doing medications for substance use disorder. The SAMHSA, which is the government substance and mental health organization, they have a website where you can look up in your area and see if there's anybody who does addiction medicine. Um, and that's important because the addiction, it's kind of my job as an addiction medicine doctor is, so I kind of say I can't help people if they're dead. And if somebody has an opiate use disorder and they're getting opioids off the street, there's actually a lot of them that are laced with fentanyl. You don't know what you're getting. And so my job is, how do I get you safe? How do I get you where you're not needing to illicit drugs off the street? And then if you do, you're going to be safe. Get you Narcan so you don't overdose. But then once I have you in a safe place physically, then that's kind of where that work, emotionally, where that kind of comes in. I tell people that I think we kind of have this idea that sitting in a circle and singing kumbaya is what we need to do to treat our substance use disorder. And that might be true, but we need to make sure that people are alive and that they are, not actively withdrawing, which can be dangerous for a
mhm,
lot of people. So really getting through that first part is going to be really helpful. And then that's kind of where then that longer term work of rebuilding relationships with your family, building those skills that you need to get a job, or many of those things that are eroded over years of being involved with substance use. So so it's really hard, Catherine. I wish I had like a great, like one, like call X, Y, or Z or do this thing. but it's really difficult, and it's even challenging just different churches. I know that, that a lot of you're kind of coming at this from a Christian perspective. There's a lot of churches that are going to view substance use disorder as a moral failing, that it's a sin, that you need to pray it away, or and that's going to be really difficult too. But there's other churches where I have a couple works with some churches who are great at getting people in to see me. And so it's really difficult because, some pastors, some clergy members are probably going to be doing a really good job of getting people connected with resources, but others might actually do more harm than good. And so it's a really challenging question to answer.
Yeah. Yeah, and I've been talking on the podcast last week's episode, I mean, this will probably be out in a couple more weeks, but was about the Jesus that I know. Because there's so much spiritual abuse in the church, and
Mhm.
there's so much people that claim to be Christians that are just way, way off, and not showing the love of Christ and not showing that compassion. I mean, Jesus was the one that, people were bringing people like the lady that supposedly was caught in adultery. They bring this lady to him, thinking that, oh yeah, he's going to be all on board with us stoning her, and
Yep.
he's like, "He who is without sin cast the first stone." He was like, "You're all sinners. Like, this is ridiculous. Like, give this lady some grace. Let's, what can we do to, bring her back into the fold and offer her healing and forgiveness?" Where was the guy that she was caught with? It's just like this double standard.
Mm.
Um, so we have that on one hand, and then we have all these Christians that are in the church that are afraid to even say that they're struggling with anything
Mhm. Yep.
because of
Yep.
worried about being n labeled as an outcast and
Yep.
and being pushed out of community because they are honest about what their feelings are and what they're struggling with. My heart is for people that anybody, any walk of life, whether, you've got struggling with addiction, pornography, obesity, whatever it is that we all deal with, that we're all struggling with it. Our relationship with Christ is a relationship. It's not based on perfection. It's progress. That's what Jesus calls us to is to be loving and to be real and not
Yeah.
be this facade of, I've got it all together, and anybody that steps out of line, here's the big hammer of judgment and correction,
Right.
and that's what was really hard for me going through everything with my ex is just I wanted him to get healing and
Mhm.
health. And, we went through medical detox, we went through
Right.
method treatment, we went through prayer with our church. We went through counseling and, kind of all of the avenues.
Mhm.
Um, and, to have him go back to it and
Yeah.
then in the end become, violent with me because I was trying to keep him from
Mhm.
going out and using again. And,
Right.
it was, it's heart-wrenching. And when you care
Yeah.
about somebody, and you're on the other end, like you want them to get that healing, but they will
Mhm.
they will bury you. Like you said,
Mhm.
they will chip you away and bury you and bury your whole family with them. And so, like, having the courage to love them from afar and walk away in having that support of, like, Al-Anon is huge.
Mhm.
I didn't end up getting into Al-Anon, but I had your parents that were
Yeah.
incredibly supportive to me. So Mike, his mom is my sister Jenny, and her, husband is Tom. Had both them on this podcast as well, and they were the ones that took us in, when we had no other place to go, and we were fleeing that whole situation, and, both of them were such huge, helps and so instrumental in my finding freedom and helping me with my kids. And, I mean, the whole family was just a wreck. Um, I mean, we talk about it now, we kinda giggle about it, how Elijah was just, um
Wearing a shower curtain, running down
yeah.
the street.
Yeah, he was throwing a fit, and we were he wrapped himself up in a shower curtain that was in the car as we were, like, fleeing. And, he was kicking everybody. He had his little green Crocs on, he was kicking everybody in the shins and, just angry and not understanding what was happening, and his whole world was crumbling. And, um, yeah, so to be able to find hope and help and, there's no just one answer. And that's what's so difficult about what you do, Mike, is it's not just, oh, we're going to put you through this program. And when you get to the end of it, all your problems are going to be solved. We're going to have uncovered all of this baggage and all this trauma, and everything's going to be just fine. People go back.
Yeah.
Even when they've had some success, they end up going back to it.
Mhm.
Um, and it's a disease. I believe there's obviously, um, not only is it there, like, it's multifaceted. I think
Mhm.
there is, not only physical and psychosocial and mental, but I think there's a spiritual part to it too, where, um, you know, and maybe that's part of, like, people feeling rejected from the church and not having that sense of community and that sense of belonging, can attribute to that too. But, um, so when somebody comes to you, like, is the treatment, ongoing, and who pays for it? Um, is it
Yeah, I say it's again, like anything else. If somebody came to me and says I have diabetes, it's is I say there's some people who come to me and they have diabetes, and they become vegan and start running ultra marathons and they lose a bunch of weight and they no longer need to be actively treated for diabetes. But there's other people where they just need to be on it for their entire life, and that's just the way it is. And it's exactly the same thing with substance use disorder. Um, in the state of Michigan, it's the medications and everything are paid for by insurance. There was a big law that was passed at the beginning of this year that made so you used to have a what we refer to as an X waiver to provide certain medications, and so you could only get it from certain providers. That's gone. The problem is there's so much stigma around people who have substance use disorder. There's a lot of doctors who still won't prescribe the medications that usually buprenorphine, which is Suboxone, Subutex for people who have an opiate use disorder. But yeah, so most people are on these medications for life. And again, that's the same way with somebody who has started on metformin or insulin for diabetes. Most people are just on it for the rest of their life. Um, but it totally depends on the person. And I say that there's, I'll kind of have multiple different people in my clinic, and there's certain people who are, you pass them on the street and they've been sober for years and they're part of my program. And, they're people that your school teachers, your pastors, your social workers, people that you wouldn't know. And then there's people that are basically just kind of still living in kind of the substance use disorder world. And we're giving them medications just to make sure they don't die, make sure they don't have an overdose, with the hope that they would, someday get to the point of being somebody who is not actively living in that substance use disorder world. Somebody who can more actively respond to their um more actively participate in their recovery. So it depends on the person, and it depends on the substance, and it depends on what resources the person has, and whether they have family around them, all that stuff. So that's a very complicated, very multifaceted thing. But yeah, depends on the person.
so, so the medications that you have to prescribe help to reduce the cravings, or what do they actually do?
Yeah. So buprenorphine, which is primarily what you use for opiate use disorder, is and that's what we can do in, like, what we refer to as OBOT, which is office-based opioid treatment, or office-based opioid use treatment. And that's gonna be buprenorphine, which basically does 2 things. So it binds to the opiate receptors in a way that, theoretically doesn't get people high. Now, there are some people who do figure out ways to get high on things, but in general, it doesn't make somebody high. But what it does is it stops cravings for opioids, and it stops any physiologic detoxification withdrawal symptoms, diarrhea, abdominal pain, cramping, anxiety, all that kind of stuff, and just kind of allows people to feel normal and just feel like they don't need to be out looking for drugs. But then what it also does is a very, very high affinity for the opioid receptors, so that let's say you have a history of opioid use disorder, you're taking Suboxone, and you just have a really bad day and you say, screw it, I'm gonna go relapse. And you get some pills from some friends and you take them, you inject them or all that stuff. The buprenorphine has such a high affinity that the other opioids that you're taking don't really do anything. And so you can't just say, oh, screw it, I'm going to get high and then get high. But that has a secondary benefit in that let's say you buy some pills from somebody and it's not, they say, oh, this is Oxy, and it's actually a pressed fentanyl pill from Mexico or wherever. And you take it where you would typically just die of an overdose because fentanyl is incredibly potent and you think you're just taking Oxy, but you're taking something way more powerful. You actually don't overdose. You just are fine.
Mhm.
And so the benefit of that is that it keeps people alive, right? And so the longer that people stay alive, the more likely they are to actually have times of sobriety and actually recover. So buprenorphine is that's the number one, the most common thing. The other thing is Vivitrol, which is we use for both alcohol use disorder and alcohol use disorders, Vivitrol, and which is an injection, or there's the naltrexone, which is the oral medication. um, but then there's also methadone, which you have to be at an actual opioid treatment program. So that's the place where you have to go daily, get methadone. So right now you have to be in a special program to do that. So I can't do that in my office. Um, but those are kind of the main medications I use. Naltrexone or Vivitrol works to block the opioid receptors so that when you take an opioid, you don't have any effects. The problem is that it's not protective against an overdose.
Mm.
So let's say you have a bad day and you say, I'm going to go use, because that's what people with an opioid use disorder do, is when they have a bad day, they use. It might not protect against an overdose. So that's why we use, the buprenorphine or the methadone, because they do that the double duty of binding to the opioid receptors, but then they also will prevent people from dying.
Mhm. So we're running low on time here, but I just was wondering if you had just some words of advice for someone who has a family member. What
Mhm.
would you say for them to do if they were trying to get them help?
Yeah, I would say do some research and see what is available in your area. Um, and you'll try to find a provider, whether it's a nurse practitioner, doctor, PA, somebody who does a lot of work with substance use disorder, is somebody who has compassion and understands the medications. That's a really good place to start, because they should know what kind of resources are in the area. They should know what they have around. And again, it can be difficult to find that person, but that's probably the first best thing that can be really beneficial.
And one last question. What
Yep.
if someone doesn't want to get help?
Then it's a great question. Um, if they don't want help, then just love them as best you can. There are some instances in which people can get help when they don't want help, such as like drug courts and stuff like that. But that's really not your job as a family member. Your job as a family member and a loved one is not to be a police officer. It's not to be a nurse. It's not to be a doctor. Obviously, if the person is doing something that is putting somebody at danger, then you need to either get out of the situation, call CPS, do the things to make sure that you or young ones are not in danger. But if somebody doesn't want help, then you kind of just have to let them be. And so that's kind of one of the biggest challenges. And that's kind of where that question you know, staying with somebody who has a substance use disorder, that kind of stuff, is one of the big questions. Is, do they want help? Do they want to get better? And if somebody wants to get help, then great. If not, then you just kind of have to let them be and just kind of hope and pray that will change. And that's a huge question, but that's one of the biggest things you can do.
Yeah. Yeah, I agree. It's that walking away and loving from afar that can be the most difficult. And, because as somebody, who's been in that situation, you want to help, you want to control that person in a way and make them
Mhm.
get the help. Come on, you got to like
Right.
snap out of it. But at the end of the day, they have to want it and they have to do the work to stay sober.
And that's where the Al-Anon, a lot of people can actually switch back and forth between being the addict and being the person who loves an addict very quickly, because it's very easy to become addicted to trying to love and trying to help somebody when it might not be the most helpful thing.
Yeah. Well, Mike, thank you so much for your time. Our video time is running short here, so I'm going to cut this down. And thank you so much for your time. You have
Definitely.
a wealth of knowledge, and it's been so enlightening to talk to you. And God bless you and what you do. And that's a tough specialty to be in, but what you do is so important, and it's such a needed resource for so many people. Seriously, what you do is just amazing. Like,
Thanks.
I could not do that. Coming
Yeah.
from somebody on the other side, and I've taken care of people that are coming down off of
Mhm.
stuff, and holy cow, it
Mhm.
is just it's rough.
Yeah. And I
Um,
think that's one of the reasons why, like, I'm pretty good at it, is even though Keith is probably like the closest family member. There's other stuff, but it's like I don't have that. I haven't been directly hurt by somebody with it, and so it's kind of easier for me to hold that at arm's length, right? I think it would be much more difficult if it was something that I had personally wrestled with, if that makes sense.
yeah, yeah. Yeah, it really does make it challenging, and it makes it hard for me to be objective a lot of times. And
Mhm.
when I have people come in and I have to be like, "Okay, I just gotta take a deep breath and,
Right.
know that I'm supposed to love this person
Right.
regardless and be of
Right.
help to them." That's my position now. It's not for me
Yeah.
to try to hear them or make them
Yeah.
help. But I
Definitely.
have people come in that are like, "Oh, I just quit cold turkey yesterday," and I'm like,
Right. And
"You
they
gotta go to the
feel like
emergency
shit. And
room."
yeah. Yeah. That's crazy. It's
So,
crazy. So
yeah. So, love you, Mike. Thank you
love
so
you
much.
too. Yeah. Anytime. I love talking about this. So
All right. Thank you so
yeah,
much.
nice chat with you, and congrats again on
Oh,
the recent nuptials.
yes. Thank you.
Hey, before you go, make sure you click and subscribe to the podcast so you'll never miss an episode. Also, make sure you go over to our Facebook group, Unstoppable Joy, your roadmap to a joy filled life, where you can find other like minded individuals who are also on their journey to finding a life of unstoppable joy. Click the link below or in the show notes. Hope to see you there. Be blessed.